The Food Institute reports that the Congressional Budget Office estimates that federal spending on major health care programs will reach 6.3% of gross domestic product by 2020. Now that's up from 4.7% this year and far above a 40-year average of 2.7%. While the federal government must find a way to pay for rising Medicare and Medicaid costs and provide for the aging baby boomers, businesses must also come up with a solution to balance the rising health care costs and employee benefits while following the provisions of the U.S. Patient Protection and Affordable Care Act passed in 2010. Some of the largest employers in the U.S. are involved in the food industry, and their efforts are being closely watched by other businesses that are responsible for a large number of employees. According to the Kaiser Family Foundation's Employer Health Benefits 2012 annual survey, the average monthly U.S. worker contribution this year was $79 per month for single coverage and $360 per month for family coverage. Walmart's announcement that its U.S. employees will pay between 8 and 36% more in its premiums for medical coverage in 2013 led some of its 1.4 million workers to indicate they would go without coverage. The retailer, the nation's largest private employer, states that rates would increase because healthcare costs continue to rise, but its employees' average costs for healthcare would only rise about 4.4% next year. That's less than the 9% average increase expected for all American workers. While Walmart pays for preventative care, such as routine checkups, workers must pay deductibles of at least $1,750 before Walmart covers 80% of the cost of other care, such as doctor visits or diagnostic tests. It will also make a separate contribution of $250 or $500 for individuals and twice that range for families. More than 50% of Walmart's U.S. employees sign up for its health care plans, and the plans cover 1.1 million people when dependents are included, though nearly two-thirds of Walmart employees pay for individual coverage. More on the cost of health care when we return. Darden Restaurants, the parent of Olive Garden and Red Lobster, are responsible for approximately 45,000 full-time workers, and they have plans to give its employees a fixed sum of money with which to purchase medical coverage through an online marketplace. Darden's exchange approach still involves employer-backed group plans and is not individual insurance and does not rely on changes in the Affordable Care Act that will be implemented in 2014. Many in the industry are watching how Darden's health insurance plan will work, and if it takes hold, some predict it may follow the transition from company-provided pensions to 401k retirement savings plans that are controlled by workers. Several big benefit consultants and health insurers expect the employee choice model to be successful. And I quote, "Within the next 2 to 3 years, it's going to be mainstream," according to Ken Goulet, Executive Vice President at WellPoint. WellPoint will launch a similar product next year. Anthem Health Marketplace that lets employers offer a variety of its plans to workers and paired with a fixed contribution.
The Lempert Report uploads right here 3 times a week with the information you need to stay ahead of the trends. For more, just visit thelempertreport.com.